Today the topic is we're going to deal with the cerebellar circuitry. So under this we will firstly look at the questions. The first question is the what are mossy fibers? What are mossy fibers? The second question is in case of the Purkinje cell, forward Purkinje cell forward inhibition. So in such a process, what are the cells involved? What are the cells involved? The third question is what are the efferents? What are the efferents in terms of the cerebrally circular? So the efferents in the cerebellar circuitry. So in this video, we'll find the answers to all these questions. And at the end of the video, we have a bonus questions. So to start with, the cerebellar circuitry includes, there is something known as the efferents. So in the efferents, we have the climbing and the mossy fibers. We have climbing and the mossy fibers. So they are present. And first we'll look at the climbing fibers. So what are the climbing fibers? So climbing fibers are nothing but firstly there is the origin. There is something known as the origin. So what is the origin? Origin is nothing but it is a contralateral. It is a contralateral inferior olivary nucleus. So it is nothing but an inferior olivary nucleus and it is present in the medulla oblongata. So it's a contralateral inferior olivary nucleus. It is present in the medulla oblongata. So where does it terminate on? So it terminates. So where does it terminate? It terminates in the Purkinje cell. Termination is in the Purkinje cell. So then we look at the mossy fibers. So what is the mossy fibers? The mossy fibers is nothing but looking at the origin. The origin is multiple sources in the spinal cord and it is from the multiple source. It's multiple source from the spinal cord as well as the brainstem. And where does it terminate? So the termination of the mossy fibers, it occurs in the granule cell. So the termination, it takes place in the granule cell. Next, we look at the intrinsic components. So in case of the intrinsic components, so in such cases, there is granule cell backward inhibition. There is the granule cell and backward inhibition. So granule cell backward inhibition. So this is done by nothing but the Golgi cells. It is done by the Golgi cells. And what this does is it prevents the transmission. It prevents the transmission. It prevents the transmission from mossy fibers to the granule cell. So it prevents the transmission. Then we have the Purkinje cells. So we have the Purkinje cell forward inhibition. So what is the Purkinje cell forward inhibition? It is nothing but it is done by the stellate or the basket cells. So it is done by the stellate and the basket cells. Then we move on to the what is known as the efferents. So we move on to the efferents. So what are the efferents? So in case of the efferents, the output is from the, we're firstly looking at the output from cerebral cortex. The output from the the output from the cerebellar cortex. So this includes the Purkinje cell, the Purkinje cell. It includes the Purkinje cell inhibitory output. Purkinje cell inhibitory output, and this is to the deep cerebellar nuclei. This is to the deep cerebellar nuclei. Then we look at the output from the cerebellum. The output from the cerebellum. So the output from the cerebellum, there is from the deep cerebellar nuclei. It is from the deep cerebellar nuclei, and this includes there is a globose. There is a globose as well as the emboliform. Then comes the dentate. So all this via the superior cerebellar peduncle. So everything is via the superior cerebellar peduncle. Then post this, there is something known as a fastigial. So what is this fastigial? So fastigial is via the inferior cerebellar peduncle. So it is via inferior cerebellar peduncle. So this is done. Now we will look at the questions to our answers to our questions. So the first, now looking at the answers, the first one is we look at what are mossy fibers. So in the afferents, we asked about what are the mossy fibers. So the mossy fibers are nothing but we are looking at the origin first. What is the origin? So mossy fiber origin is that there is a multiple source in the spinal cord. There is a multiple source. There is multiple source, and this is in the spinal cord. Multiple source in the spinal cord and the brainstem. Multiple source in the spinal cord and the brainstem. So where does it terminate? So it terminates on the granule cell. Termination, if you see, it occurs in the granule cell. And the next question we asked was in terms of the Purkinje cell forward inhibition. So in terms of the Purkinje cell forward inhibition, it is done by, what is it done by? So it is done by the stellate. It is done by the stellate and the basket cells. So Purkinje cell forward inhibition is done by the stellate and the basket cells. This was our second question. Third thing was they explain the efferents. So in efferents, there are various components. So first thing to note is that the output from the cerebellar cortex. So the output from the cerebellar cortex. So this is from the Purkinje cells, from Purkinje. This is from the Purkinje cells, inhibitory output to the deep cerebellar nuclei, to the deep cerebellar nuclei. And then we look at the output from the cerebellum. So then we look at the output from the cerebellum, and this is from the deep cerebellar nuclei. This is from the deep cerebellar nuclei. So first we look at the globose. So the globose, emboliform, as well as the dentate, and this is via the superior, this is via the superior cerebellar peduncle. And then we look at the fastigial. So the fastigial is nothing but it is via the inferior, it is via the inferior cerebellar peduncle. So now we'll be looking at some of the bonus questions which are there, and it can be answered in the comments. So we are looking at the bonus questions. So under bonus questions, the first question we would like to ask is, what are the climbing fibers? Question 1, what are climbing afferent fibers? What are the climbing fibers? So what are the climbing fibers? Next question is, we want to ask, what is the granule cell? What is the granule cell backward inhibition? So what is this done by? This is an intrinsic component. So what is this step done by? So these answers, it can be, you can give it in the comment section.